If you are over 60, one of your sweetest and juiciest daily habits may be quietly increasing your risk of a stroke, without warnings, symptoms, or pain. You could go to bed feeling perfectly fine, only to wake up with slurred speech, impaired balance, or a limb that refuses to move. Clinical observations frequently document cases where older adults suffer an unexpected stroke, and the culprit isn't smoking, fast food, or lack of exercise. It is something they genuinely believed was healthy. Fruit. Millions of people enjoy fruit every day, thinking they are supporting their heart and brain health. And while the right fruits do indeed promote healthy longevity, some, especially when eaten at the wrong time or in the wrong quantities, can cause hidden harm. They can trigger sharp sugar spikes, thicken the blood through hidden dehydration, or enter into dangerous chemical reactions with your daily medications. Today, we will analyze 9 common fruits that can quietly increase the risk of vascular catastrophes after 60. We will examine the biological mechanisms behind these processes and discuss how to protect your brain without giving up life's simple pleasures. 1. Bananas. The hidden potassium overload. Bananas have been marketed for decades as the perfect snack. They are soft, easy to digest, and rich in potassium. For a 30-year-old body, this is true, but after 60, the rules change. As we age, our kidneys naturally slow down. Their filtering capacity decreases, especially in the presence of high blood pressure, diabetes, or the use of diuretics. As a result, the potassium abundant in bananas, about 450 milligrams in a large fruit, can begin to accumulate in the blood. Excess potassium disrupts the heart's electrical signals. Blood vessels narrow, and clots may begin to form in the bloodstream. There are known cases where active older adults who ate a banana before bed, along with their blood pressure medication, suffered a stroke in the morning. At night, circulation slows down and an excess of minerals creates a perfect storm for thrombosis. How to stay safe. Limit yourself to half a banana a day and eat it only in the morning. Always pair it with protein, such as a handful of nuts or Greek yogurt, to slow absorption. Never eat bananas before bed. 2. Grapes. The fast-acting sugar bomb. Sweet, refreshing grapes seem entirely harmless. However, for an aging brain and vascular system, they can become a hidden trigger for inflammation. Grapes are essentially concentrated sugar in a thin skin, almost entirely devoid of the fiber that would slow its absorption. A handful of sweet, seedless grapes causes an instant glucose spike. With age, cells lose insulin sensitivity, and this sharp rise in sugar literally scorches and inflames the delicate walls of the arteries. Inflamed vessels lose elasticity, and microscopic lesions appear on their inner lining, endothelium. In an attempt to patch these micro-injuries, the body forms blood clots, the very ones that can lead to a transient ischemic attack, mini-stroke. How to stay safe. Never eat grapes on an empty stomach. Pair them with protein or healthy fats, for example, with a slice of cheese. If you have diabetes or unstable blood pressure, it is wiser to replace grapes with low glycemic berries, such as blueberries. 3. Pineapple. Nighttime reflux and drug conflicts. Pineapple is often praised for bromelain, a natural enzyme that aids digestion. But for older adults, this tropical fruit harbors several threats at once. First, bromelain breaks down proteins and can directly affect blood clotting, especially if you are already taking blood thinners. This, unpredictably, alters platelet function. Second, pineapple is extremely acidic. Eating it after dinner can cause asymptomatic nocturnal reflux. Microscopic droplets of acid can enter the airways during sleep, causing spasms, a drop in oxygen levels in the brain, and a sharp spike in blood pressure. A classic scenario for a morning stroke. How to stay safe. If you love pineapple, eat only a few small pieces earlier in the day. Avoid it if you are on anticoagulants, and categorically avoid it in the evening. 4. Watermelon, the dehydration paradox. Watermelon consists mostly of water, so it seems like the ideal hydration tool, but in reality, it has a powerful diuretic effect. For an older adult already taking diuretics to control heart failure or blood pressure, a couple of slices of watermelon after dinner can lead to severe nighttime dehydration. When the body loses water, the blood thickens, turning into a consistency like thick syrup. Thick blood flows more slowly, creating ideal conditions for clots to form in age-narrowed arteries during sleep. How to stay safe. Eat watermelon only during the day, and always supplement it with electrolytes, for example, a pinch of salt. Listen to your body. Morning dizziness or severe dry mouth at night is not normal. It is a sign that your blood has become too thick. 5. Oranges. The citrus. Interference. Orange juice has been considered a symbol of a healthy breakfast for decades. But citrus fruits contain a specific compound, furanocoumarin. This substance blocks liver enzymes, specifically the cytochrome P450 system, responsible for breaking down and eliminating drugs. If you take statins for cholesterol, or calcium channel blockers for blood pressure, furanocoumarins prevent the liver from processing them. As a result, medications accumulate in the blood to toxic levels, causing dangerous drops in blood pressure, vascular inflammation, and unpredictable thrombosis. How to stay safe. If you regularly take prescription medications, treat oranges and grapefruit with extreme caution. Consult your doctor about potential interactions. A safe alternative for getting vitamin C is red bell pepper. 6. Apples, sweet varieties, glycemic seesaw. The saying, an apple a day keeps the doctor away, is well known. However, modern popular varieties, such as Fuji or Gala, have been bred by selectors for maximum sweetness. They have a high glycemic index. Regular consumption of such sweet apples solo, without fats or proteins, causes an insulin roller coaster. Constant sugar spikes exhaust blood vessels, make the blood more viscous, and increase the risk of endothelial damage. How to stay safe? Choose green, tart varieties like Granny Smith. They contain much less sugar and more protective polyphenols. And always pair the apple with nut butter or cheese to smooth out the glycemic response. 7. Cherries. Natural salicylates. Cherries have powerful anti-inflammatory properties, but they harbor natural salicylates, substances that act similarly to aspirin in the body by thinning the blood. If an older adult is already taking blood thinners, warfarin, Xarelto, or daily aspirin, a daily evening portion of cherries can push the system to the limit. The blood becomes too thin, and fragile vessels in the brain may not withstand the pressure, leading to a hemorrhagic stroke, intracerebral hemorrhage. How to stay safe. If you take anticoagulants, consume cherries rarely and in minimal amounts. Avoid concentrated cherry juice without consulting your cardiologist. 8. Strawberries, pesticides, and uric acid. Year after year, strawberries top the list of fruits with the highest pesticide residues. For an aging body whose detoxification systems work more slowly, these chemicals become neurotoxins that accumulate in brain tissue and weaken small blood vessels. In addition, strawberries contain purines, which are converted into uric acid. For older adults with gout or kidney issues, excess uric acid causes systemic inflammation, which narrows arteries and again increases the risk of blood clots. How to stay safe. Try to choose only organic strawberries and wash them thoroughly. Do not make them your sole source of antioxidants and consume them in moderation. 9. Mango. Tropical overload. Mango is one of the sweetest fruits in nature. 1 cup of ripe mango contains about 45 grams of rapidly absorbed sugar. This massive glucose surge overloads aging blood vessels. But even more importantly, mango contains mangiferin, a compound that, like components in grapefruit, can interfere with liver enzymes. This causes medications for heart rhythm or blood pressure to stay in the body longer, causing nighttime pressure drops to critical levels. Too low blood pressure during sleep deprives the brain of necessary oxygen. How to stay safe. Consume mango extremely rarely, literally just a couple of small pieces, and only during the day. Be sure to balance it with protein and monitor for interactions with your medications. Safe alternatives for the aging brain. Upon learning about these hidden risks, you may feel confused, but giving up fruit is not the solution. It is simply important to adapt your choices to the needs of your aging body. Here are foods that truly protect the brain and blood vessels. Dark berries, blueberries, raspberries, and blackberries. They contain minimal sugar and maximum anthocyanins, unique antioxidants that can cross the blood-brain barrier and directly protect brain cells. Avocado. Technically a fruit, it contains almost no sugar but is rich in monounsaturated fats. These fats act like high-quality oil for your blood vessels, maintaining their elasticity. Green apples, Granny Smith. An excellent source of fiber and polyphenols without the sugar spikes. Lemons and limes, ideal for flavoring water. They support digestion without a glycemic load. Pomegranate, in small doses. Contains compounds that trigger cellular renewal, but because of its natural sugar, it requires very moderate consumption, best as seeds added to a salad. Golden rules for eating fruit. After 60 timing is everything. Eat fruit in the first half of the day when your metabolism is most active. Never eat on an empty stomach. Always pair fruit with a source of protein or healthy fats. Nuts, seeds, unsweetened yogurt, or cheese to slow the absorption of sugar. Bedtime taboo. Avoid any fruit 2 to 3 hours before sleep. At night, your circulation slows down, and any spikes in sugar, acidity, or hydration become exponentially more dangerous. Aging is not a weakness. It is simply another stage of your body's operation, requiring a bit more wisdom, attention, and respect for biological processes. Your brain reacts to every choice you make. By choosing the right foods at the right time, you are investing in your independence, a clear mind, and many years of comfortable life. Take care of yourself, listen to your body, and approach your health mindfully.